You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Today is Friday, April 5th, 2019, and welcome to another episode of Last Week in Health IT. And as with every episode, we start off this one stating that the intended audience for this episode is everyone. So today we'll be talking about some April Fool's fun, regional record sharing, telehealth, AI, deep learning, and FHIR Release 4. Let's get into it. So Epic's Epic April Fool's prank. We'll start off with a fun article. So Epic, known for their Epic EHR, announced a few interesting news items on their April Fool's April 1st post. So the first thing they said was that they hired Mad Money host Jim Cramer as their financial advisor, followed by an announcement of a new solution similar to their MyChart product, but calling it My Mom, because nothing gets you moving like a suggestion from mom. There was also an announcement of a buyout of Fitbit, and they stated that they had a joint partnership with Epic Games. And if you don't know, Epic Games is the company responsible for the very popular video game Fortnite. They said that they've become the official support division of Epic Games and can wrap up a Fortnite ambulatory visit in 3 to 5 seconds under heavy fire by rocket-propelled grenades, comically adding that they would use this experience to replicate the customer experience in the emergency department. Alright, so let's get into real news. England's regional record sharing project selects Cerner for their HIE efforts. And for those of you who don't know, HIE is Health Information Exchange. So in England, there's an effort to achieve a regional record sharing for patient records from across the northeast to North Cumbria, and this is entitled the Great North Care Record. The initiative selected Cerner to be its partner and supplier. So Cerner is the other EHR vendor that's really popular. And the goal is to help share information within the region so that they can provide better care for their regional patients. And this will be done through the introduction of their Medical Interoperability Gateway and their Information Sharing Gateway. And right now, it allows their various healthcare practitioners to access information from the patient's record in times of emergent need. Alright, so the next news item is telehealth becomes more prevalent in New Zealand. So a new survey shows that telehealth is being used more often in New Zealand to connect providers and patients without the need of the patient to leave their own home. The really great thing here is that they also found out that there was an increase in the number of different services provided to the patient. This makes sense, since telehealth makes it more convenient for the patient to receive care and also allows providers to be more efficient in delivering their care. So it's been said that by the New Zealand Telehealth Resource Center that it owes some of their success to the improved interoperability between video conferencing services that allow people of different platforms to work with each other. Alright, so the next thing is Healthgrades launches a customer data platform for healthcare. So Healthgrades, if you don't already know, it's a web-based resource for information on healthcare organizations, hospitals, and providers. And they recently released a customer data platform that aims to connect siloed datasets to form a complete picture of the patient profile. And to address technology needs, the platform applies artificial intelligence, deep learning, allowing more personalized experiences between the provider, health organization, and the patient. Alright, so the next news item is AI-enabled Internet of Things analytics are being explored by a partnership between SAS and Siemens. So the analytics are going to be used in cloud and edge computing using predictive analytics in the open and cloud-based MindSphere, allowing AI and machine learning deployment into Internet of Things environments, so IoT environments. And just as a reminder, Internet of Things, these are devices that connect Wi-Fi to a network of things, such as smart pumps or even automated dispensing cabinets. So this is great to see partnerships like this going. And this is one of the many partnerships that's going right now that is pushing technology advancements in the healthcare arena. And also speaking about deep learning, Berkeley is using deep learning to address suicide risk among veterans. So algorithms are being developed to produce tailored and dynamic risk scores for the VA patients. And this will help the VA target and treat medical and psychological challenges of patients returning from active duty. So basically, they're working with a giant data set of 40,000 patients to find some sort of pattern or trend that points to suicide risk. And the resulting deep learning network will be able to help distinguish risk levels in patients with suicide risk. Alright, so the last thing I have is Cerner adopts FHIR Release 4. Alright, so FHIR Release 4, FHIR R4, is an interoperability HL7 interfacing standard, and it was released at the same time I started this podcast actually. This was back in early January, so it was only 3 months ago. And only 3 months ago, this was released, and now Cerner is showing that they've been able to be open arms and adopt this new standard, FHIR Release 4. This is a pretty big deal. It's a really huge step because Cerner is one of the largest vendors in the EHR market. So for them to adopt the FHIR Release 4, FHIR R4 standard, it lends credibility to the standard, and it's pretty much a statement to all the competitors saying, hey, we're prepared. Are you? So before we go, if you'd like to hear more news on healthcare IT, you can check out great curated articles on healthcareitnews.com. It's actually where I go for daily healthcare IT news, and it's to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you guys can subscribe and rate us on iTunes, Stitcher, Google Play, Spotify, or any of your other favorite podcasting services. You can also follow us on social media, on Twitter, Facebook, at PharmacyITme, or our Instagram at PharmacyInformatics. Or you can send me an email at tony@pharmacyitme.com, or follow my Twitter account at TonyDowPharmD. And finally, before we go, I wanted to plug a great networking opportunity. It's called Pharmacist Connect. You've heard me say this before, and I'm going to keep saying it because it's such a really great resource. If you guys are familiar with Slack workspaces, think of it like that, but it's a vetted workspace where to get into this workspace, you have to have an active license. So you're a pharmacist, pharmacy technician, pharmacy intern. That's how you get into this network. And then it's kind of like a group chat, and you guys can talk to each other and network with each other. And there's also different channels, and some channels have niches in them. Like there's one right now for informatics. There's also one for the hospital space. And, it's always like changing and evolving. And you can find out more by visiting pharmacistconnect.com, which is at PHARMACISTSCONNECT.com. And thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.